guys.
So I am here with Sylvia. We are talking all things, we were just talking all things mobility on her page. So if you go to her page, you can kind of see we talked about stress, we talked about mobility, we talked about
Lots of hip mobility, lots of stress, anxiety.
Yeah, so things that are going on within her own body and how we can kind of relieve it. So it kind of helps her out with that on her page. So if you go over to Sylvia, what is it?
It's Sylvia Outfit.
Sylvia Outfit. Here, let me pin it so that you have it. Sylvia L.
Yeah.
Okay. Hi guys. Okay. So this is actually funny. Sylvia and I know each other for like, get in here more.
Am I too out of the?
Yeah,
there we
too
go.
out of it.
Okay,
So we've known each other for like 10, 11 years maybe.
When Jen was little.
I was just graduating. I had just graduated high school. I think I was in college for like a year or two or something. And I was coaching gymnastics at the time. And then this woman stumbled into my gym.
Stumbled, right? That's exactly right.
And she started teaching a Pilates boot camp. And she allowed people to come who were coaches and kind of come for free. So I definitely took her up on that one. And I came like every single time.
Yeah. And I couldn't get rid of her after that. Like she kind of stuck. Like there was no getting rid of her.
But she taught me all I knew about Pilates. She really broadened my mindset, got me open in the Pilates world. And it was funny, I was telling her how like I used to walk into a yoga class and kind of stroke my own ego and just like move through the motions, not really paying attention to what I was doing, how I was doing it. I was just moving through the motions and I'd be like, that was easy. And then this woman over here, she would really she started getting on me in terms of like, well, no, you need to hold in like this, you squeeze this, are you pushing here, are you pulling here, and all these little things. I started to be like, what is happening?
Like I'm supposed to get it, right?
Yeah, and she would turn on muscles I didn't even know existed at the time because I was not in PT school. I was not even anywhere near that yet, and I was very new in like the whole movement world.
Right, and it's true because I remember her face was, I got this.
Yeah.
I'm not going to be sore.
Yeah.
And that was my goal, really, that it was like, no, I'm going to show her, how to really kind of connect the mind, connect the body, really pay attention to what you're doing because, there's so many times that people move through exercises or movements or anything and not being aware, like, oh, I'm just going to do this, but not connecting. And you're missing the whole point.
Yes, exactly.
You're missing the entire point of what you're doing and why you're doing it.
Mm-hmm. Oh, totally. And so you really helped me to discover, like, what is that connection? What does it mean to hold a plank? Like, because you can hold a plank forever, but when you really dial into how a plank should be, you can't hold it more than like 30 seconds.
Right, without shaking. Like without shaking, because, and it's so true, everyone's like, oh, I can do it, but they have such bad form and they're just not even really thinking about what they're doing, how they have to hold their abdominals, like what muscles need to be firing to know that you're doing it right and to not have serious back pain after that, because that's usually what happens.
Totally.
It's kind of sad to see sometimes. I see people doing it, I'm like, I gotta close my eyes. Like, I can't see.
Yeah.
I'm like, I'm not watching. I can't do that.
Yeah. So she really helped me dial into my body, teach me about these little muscles that we forget about often. Because especially with group classes, you can go into a group class and work out all you want, but that's where a lot of injuries come from because you're not really sure of what's happening.
Right, you don't know what's happening, and you're just thinking, I just want to get my sweat on. Like, I just want to make sure that I come out of this sweating, and just disregard, the proper movements and the proper muscles that you have to engage. Because when you do it right, when you do movements correctly, you shouldn't really be doing more than 10, 20 reps of anything.
Right. You don't need to do a lot.
You don't need to be.
You could be holding and sweating.
Holding and sweating, and that was my goal with with
Yeah.
this. Like,
Her goal
I'm going to
was
break her.
Always. She'd be like, oh, she's wearing a sweater today. We're going to get that sweater off. And I'd be like, no, you're not. I'm cold. I'm going to wear a sweater this entire workout.
Yeah, and it's funny because, you know, years ago, Jen would have this face, like, I'm not cracking, like, serious poker face. You know, and we're just talking
no
about
pain, nothing.
Like, I got this, and little by little, I could see her face like, oh God, this hurts. Is she gonna stop? I'm like, yes, I got her. Like that really was, and it was more so too, is just to teach her how to understand, like to really dive in deep. You know, to really, you know, because she has such a threshold of, you know, movement and pain that. You know, I mean, being a gymnast.
Yes.
You know,
you don't break.
You don't break.
Yeah.
And I just wanted to show her, like, that was my, you know, besides breaking her, is really kind of showing her how to use those two together. Like, really being strong, you know, mindfully.
Yeah.
To really dive in deep with your body.
Yeah. Yeah. She definitely opened up that whole world. And it's like, it's funny because, you know, when I started Pilates with her, it was at a gymnastics gym. So it's not like your typical, what people think of Pilates.
Exactly.
Meeting reformers and Cadillacs and all the other things.
All the other fancy equipment, because that's what people automatically think. Like Pilates, oh, it's all the fancy equipment. But no, it's like I took it bare down to strictly body weight.
Yeah.
You know, and that's really the foundation.
And that's what you have now, right?
Right.
Is your body weight.
Body weight Pilates, which is, that's what it is. It's like you don't need any equipment, nothing. It's just you, your body, and the floor. That's it. Because that's all really what you need.
Right.
No, that's it.
Yeah.
And to feel that, I mean, I still break you sometimes.
Yeah,
maybe.
she's still. Especially now, I've been eating a lot this holiday season.
But it's nice because it just shows you and it makes you aware of your body, of the movements, and how to actually hold your abdominals right. Because a lot of times people are just, they wonder why if they're doing 100 of sit-ups, why don't they have flat abs?
Yeah.
You know, and it's just like you don't have to do that many.
Right.
You know.
Or we've seen people who have, you know, CrossFitters who do have the six-pack and look really fit and look amazing and are amazing, not saying you're not, but sometimes have zero idea what a pelvic floor is or what a transverse abdominis is and how to contract it. Yes,
and I'm definitely going to speak on that because, you know, part of, you know, when I did have my studio was part of a CrossFit, and, you know, working with those, they're amazing athletes, you know, those workouts that they put their body through, but trying to get them to connect, you know, to understand what the transverse is and why they need to hold it. You know, they have these shredded abs, but they have no clue of how to hold it and how to actually properly engage and fire their abs.
Right.
And after just like maybe 1 or 2 sessions, they're like, oh my God, I'm dying. Like, I want to go back and lift a barbell.
Yeah.
Like, this is killing me.
Because it's hard
It
sucks when you're doing these like little tiny movements and you're like, why am I in so much pain right now?
Right, and it could be just a small little adjustment or movement.
Yeah.
Like, oh my God, why'd you do that? Because it hurts so much more.
Yeah.
It's like, well, that's really, it's not that I want, you know, people to feel pain, is that I want you to feel that muscle actually working.
Uh-huh.
You know?
What is like the couple of exercises that you find are, so when people are moving through exercises, what do you find the thing that people are most forgetting to engage? So what are like your cues that you kind of have to keep giving people?
Engage the pelvic floor.
Pelvic floor.
Pelvic floor. I mean, because that's really the foundation. Like, that's the basis of everything, you know, because that's where if it's not strong and you're not thinking about it, like, you're going to, right away, your back is going to kick in.
Yeah. So what do you say for guys? I have my cues that I think people have heard me say, which are kind of funny.
I have so many, I mean, gosh, like working with...
What are your cues for guys? Because guys, you do have a pelvic floor as well.
You know what's so funny is that men think that they don't.
Yes.
And guys, you guys do.
Yes.
Okay? Like
you got muscles down there.
You got muscles down there, and it does exist, and another thing, you know, and it depends, you know, guys that are in their 20s are not thinking about this, but as you get older, it's a huge issue. Okay, so you really, not to
because
get
when
technical.
you, well, I'll get technical.
I'll let the doc
I'll get graphic.
You can get graphic. I mean, yeah.
So for a male, if you want to keep going getting excited so that you can perform. As you get older, it gets harder. And one of the reasons is you're not having a good blood flow going into that area. So understanding how to contract your pelvic floor for a male actually helps for erections.
Yes.
Especially as you get older. So understanding and doing Pilates and understanding what your pelvic floor is and how to engage that can help when you get older and you still want to please some people. Just
you know what? I love how you put that. That was really, I couldn't have done it.
But what's your cue for guys? Sorry, mine.
I don't know that mine would be that much. I mean, mine is just a bit more of kind of a little more simple as far as like if you're peeing, you kind of hold the pee.
Mm-hmm.
But if you're bearing down, I know sometimes like, okay, you want to think about as if you're going to the restroom, but that feeling where you're like, I gotta go to the bathroom and there's no bathroom in sight. You gotta hold it, right?
Uh-huh.
And you're thinking in and up because you're like, I really gotta poop and I can't poop. In and up. That's how I help men think about.
That's a nice cue.
That's a nice cue, right? It's nice, right? I didn't get as graphic as this.
So what I say...
There's another one, but I don't know how graphic we want to get here.
What I say is for a male, you think of when you're going into really cold water and you pull your balls up and in. Because you don't want them to touch the water. I haven't experienced this myself, but this is what I hear.
I love it.
Helps to pull the pelvic floor up and in. So you can use hers or you can use mine.
I really try to. You see that? You see the funny thing is you can't tell, but I'm like blushing. Like, oh my god.
It works. It helps.
You know what? It works. I mean, there's definitely exercises. I mean, having private, male clients. Actually, I had a few that were older and they had issues. They had erectile dysfunction. I mean, they had prostate issues. Like it was an issue, and I would tell them to do certain exercises. And at first they were very embarrassed. They're like, wait, what? But then after, like, oh my God, Sylvia, I have to tell you something. Like, hey, it really worked. My wife, she was really happy. I'm like, all right, now we're talking. So it's. But it's things that you don't really talk about. Like, this is not something that men really talk about because it's not supposed to be a thing.
Yeah.
It's really not. But it is. You want to really take care of it and make sure that you are engaging that pelvic floor. Use my little nice method. Just want to think about that.
Yeah. And then what is your cue for women? Because we always think Kegels. We
think about that,
but what is a Kegel?
And it's funny because I tell women, when you think about it, what's funny? Actually, I'm going to back this up. Some women don't even know.
That's the
thing.
Some
women, they don't, what do you mean? What are you talking about? And I just see this look on these women's faces. They're just like, what is that?
Yeah.
And it's, women, my age and older, and still young women too. Like they just don't understand, what the heck, what is it? How do you even engage it? Sorry. I don't know.
She's getting out of my picture.
I'm getting sorry. I seem to be leaning. I talk a lot with my hands, so I need a little more room. What can I say?
You can hit me. It's okay.
As far as for women, how to engage the pelvic floor is, oh gosh, I have so many visuals right now. I just want to try to keep it.
You can go with mine.
You can try to keep it a little clean. I have to keep it clean. I mean, I can tell you something you can do after the fact that your partner will really appreciate. Let me explain this one first. As far as for women, what I do tell them is the same thing as if you do have to bear down, especially for women that have had children, that when you're having natural birth, you're pushing down. I tell them, think about that, but you're doing actually opposite, thinking that's in and up. Okay? And as if you need to use the restroom and so forth, that there is none around, that's what you want to think about too. And there are other cues that I tell them is you kind of, when I'm in person with somebody, is you are touching the lower abdominals. It's between the belly button and the pubic bone. Because a lot of times people are like, well, where is it? What does it even exist? So it's talking about really thinking about tightening that and thinking up, in and up. So I know mine is probably not as graphic as Dr. Jen Fit, but I'm curious to know. And I have 2 other exercises that I usually tell women so they can find it.
So my cue is it's all getting at this similar things, but so that you can visualize it a little bit better, there's blueberries on the floor and you want to suck them up and in. So you're picking up a blueberry and you're pulling it in. You'll never look at blueberries the same.
Never look at blueberries
but
the same.
It helps. Because there's actually been studies that have been shown that where people think that they're doing a Kegel and contracting the pelvic floor, but they're actually bearing down and they're doing the exact opposite. And so it really is, it's not just a squeezing motion, because sometimes when you squeeze, you will bear down and your pelvic floor will drop. And so when you're actually engaging through the pelvic floor, you're pulling up and in.
Yes.
And that's the thing that...
that's the thing that women, they don't get. You know,
it's hard.
It's hard because you have that sensation of, okay, I'm going to bear it down, and you're pushing out.
Yeah.
Because sometimes people think, okay, I'm just going to push my stomach out and push everything out. Okay, but it's tight. I'm like, no, you don't want things to fall out. So you don't want to bear down. So you want to think opposite. You want it in and up and tight.
Yes.
You know, because for women, that's another thing. As we age, things start to fall.
Yeah.
You know, and that's another big issue. I've worked with some women that have had surgery.
Yeah.
You know, and
prolapse.
Again,
it's a real thing.
It's a real thing, but nobody talks about it.
Well, and especially so what her and I were also getting at is that when it's natural, it happens to everyone. When you have a baby, your pelvic floor drops. It drops, it becomes weak. And so then you go into these workout classes and you jump rope and you're jumping around and you have to go to the bathroom, you have to pee every second, and everyone just says, oh, it's natural because I had a baby.
That's like the worst thing. Like, it's like, I say, no, it's not.
It's not natural.
It's not natural.
It shouldn't be happening.
No, and it's knowing how to and what to do to be able to strengthen the pelvic floor, identify it, and know, okay, all right, I found it. Ooh, it's not, I don't feel that it's strong. I mean, I don't know how graphic I could get with telling people how I tell women how to well, the funny thing is that I think a lot of women are very shy about really thinking about this and really kind of exploring their body to know, okay, where is this at?
Mm-hmm.
And normally what I do is I tell women, okay, when you're in the shower, you know, you want to, gosh, how can I can really get...
What do you want to do in the shower?
Okay, so again, I was just trying to figure out how X-rated to get here. I tell women what you want to do is you do want to use a finger and you do want to insert and squeeze.
Mm-hmm. And see if it's working.
You know, and
it's medical, guys. It's not sexual.
No, it is. I mean, you're in the shower already. You're cleaning yourself, and that's what I tell women to do. And they're, okay. They come back like, Sylvia, I tried it, and I could barely feel any pressure on my finger.
Mm-hmm.
Like, that's your pelvic floor. That's telling you how tight it is. Like how, you know, if it's weak, this is what we need to strengthen.
Right.
You know?
And then there's always a balance. So I go back to the balance. So what can happen is if you think, oh no, it's weak, now I have to restrict. I mean, imagine doing that for your bicep. Mm-hmm. Oh, my bicep doesn't know how to contract, so now I'm just gonna hold it like this all day long.
Right.
Well, then that's bad as well.
That's bad
so
as well.
it's also finding the balance. It's breathing, because even naturally when we breathe, our pelvic floor should be lifting and dropping, lifting and dropping with your breath. So when you really are breathing from the diaphragm and getting that intra-abdominal pressure to change, you're actually pushing on the diaphragm. So as I breathe in and everything expands, I'm actually pressing down on my diaphragm as well. So it's dropping. And then as I breathe out and everything kind of comes in, the transverse abdominis starts to contract as well, and your pelvic floor lifts. So you get this natural you know, elasticity, so that it doesn't get spasmed, it doesn't get over restricted, but you want that balance. You want that balance of, can I relax fully and can I engage fully?
Right, exactly. And you make a a good valid point there, because you think, okay, I'm going to keep it tight the whole time because I don't want, I don't want it to be weak. I don't want it to be loose.
Right.
So it's having that balance and just having and knowing that.
Yes.
So that's super.
It's always about a balance, and for me especially, it always comes back to breath. Are you breathing? Because if we're breathing from here, we're not getting much change from here, and then you're not getting that natural like press and release onto that pelvic floor.
Right.
You're not getting that diaphragm and that low rib cage to open and expand.
Right.
So you're not getting that natural elasticity, and that's where a lot of spasms can come from. So that's where on the other spectrum, people like can have anything that inserts, which there's painful sex.
Yes.
It's painful and it hurts, because now imagine again that bicep just like always contracted.
Just tight.
Yeah,
right.
So now imagine a pelvic floor just in complete spasm. I mean, people complain about back spasms. It's the same thing. It hurts. You wouldn't want, something to tear those muscles apart. Just it's the same as like kind of going in and forcing sex when it's not ready.
Right, exactly. I know it's an important topic, because I know a lot of times people don't really know.
People are embarrassed.
They're embarrassed,
Mm-hmm.
And especially, I'll say this for women, as a mom myself, it's an embarrassing thing to talk about. It really is. But to really like dive deep into it and really kind of get a handle of it, you won't be peeing when you laugh or when you jump. Because again, it's not fun.
No, and it's not normal.
And it's not normal. Yeah.
And that's what people need to realize. Like if you are, if that's happening, it's called incontinence.
Mm-hmm.
It's a medical diagnosis, and it can be fixed.
It can be fixed. Yeah, so make sure no more peeing in the pants.
No.
Make sure you are aware
Depends.
of
You don't need
We're gonna
that.
put them out of business, right?
Yeah, when you actually start learning.
To.
And it's okay to like use it. It's the same thing as like how I kind of feel about orthotics or anything like that. It's like it's okay to use these things as a basis for what you're going to get away from.
Right.
So if you're using orthotics to kind of help at first to take off pressure, to change the foot, but then you're also strengthening and doing corrective exercises and doing things that your feet need so that they hold that position without orthotics, that's where the beauty happens. Right. Same with like, okay, say you need Depends right now because you leak a little bit. Okay, great, use it. It's there, but then we're going to learn and we're going to teach you, especially her program is going to teach you how you don't need to rely on it anymore, and you can do things to strengthen properly so that you don't leak.
Right, you don't leak. And, the other added benefit too is that you get amazing abs with Pilates.
My abs are Pilates abs, and
like,
they don't go away, which is amazing.
They don't go away, and and just Pilates abs, they just look differently. They're just, it's almost as if like you're wearing a corset and it just kind of tightens.
And that's what it feels like.
It does. Like you feel like you're walking taller.
Yeah.
And it's just everything is nice and tight. Like it feels so good.
That's what I love about Pilates. It really is like every time. And guys, I am across the board. I like Pilates, yoga, weightlifting, running. I don't really like running, but I do it. But I do things across the board. I love my HIIT workouts. You guys will see me post that in stories all the time. But I do it all. But when I leave Pilates, especially, I feel just like tight, but not like tight like I'm stiff, but like tight and like I'm strong and like just like sucked in without having to suck anything in.
But it's true.
Yeah,
it's true. It's like you feel like you have this corset on. It just feels like it's the foundation. I'm mainly Pilates, but I do too. Like I'll CrossFit, I'll lift, and
I get her to do HIIT workouts with me.
Yes, definitely. And and it's because doing Pilates actually helps me to hold everything nice and tight.
Mm-hmm.
Because I don't want anything dropping or falling.
Yeah.
And I want to keep tight abs. Especially after having a kid, like you want those tight abs.
Yeah, and it helps across the board. If I can now hold my core, not for my six pack, but my actual core, which includes your transverse abdominis, your multifidi in your back, and your pelvic floor. So if I can all around hold this really nice, and it just naturally, my brain knows how to go there, then I can lift heavy. I can push things overhead. I can squat low because I can hold my core. So it just translates better to everything.
It does. It really does. And it's the foundation.
Yeah.
It's mainly that foundation, and just knowing that once you have that, everything else is just kind of extra.
Right. So someone said, but I've never had a child, so no, I haven't experienced incontinence or anything like that. But as a physical therapist, I've worked with clients who have experienced this, and we've been able to get out of it. And Sylvia is a mom, so she directly is talking into this and can talk into this, and I know many people who can talk into this. So even though, no, I haven't experienced it, and maybe I will at one point, because like I said, it's natural for your pelvic floor to drop. That is something that's going to happen, but knowing how to balance it and how to strengthen and how to work into that is what's key.
And I'm going to say this because this was my personal experiences. Before I had my son, I was already practicing Pilates and doing Pilates. And I had natural childbirth with my son. And I was able to, I did it with no medication, no nothing. I was able to control the
Strong
movements.
lady.
Yeah, and it's funny because people are like, oh, why are you bragging? I'm not bragging. It's, it's the fact that I was able to control what my body was doing.
Mm-hmm.
And I had a strong pelvic floor, so I was able to have natural childbirth. Like, I was in labor for 6 hours. Like, it was, a beautiful thing, because I know a lot of women struggle and a lot of women have such a hard time, but I know that was one of the reasons why I had, I was able to have a really good childbirth, really good experience. Yeah. And then after having him, I was able to really tighten up the pelvic floor again, because yes, it goes through trauma. Your body goes through trauma.
It goes through trauma.
It goes through trauma.
Every time you work out, your body goes through trauma.
It does. It really does.
Every time we work out, we're tearing muscle tissue. We're breaking things down in order to build on top of it.
Right, exactly. And again, like, this is, for women that haven't had kids or anything like that. I mean, it's
preventative.
Everything. It's preventative. You don't want to wait until things are falling and things are leaking.
Mm-hmm.
Like, you don't. You
do
want
it before, so you don't have to experience
exactly.
that.
Exactly.
That's what's key. And especially, you've worked with women who have diastasis recti, right? Which is a huge question I get on here all the time.
And it's actually women that are not just moms. I do see a lot of CrossFitters, and I say that only because I've worked with those athletes.
Yes.
And that's such a huge, because again, they're pushing out. Like, they're just
bearing down.
They're bearing down.
Yeah.
And it's just opposite of what you want to do. You don't want to push anything. You want to keep everything tight and pulled in.
Which that is the technique for when you're lifting super extremely heavy weight. You bear down so that you can get that abdominal pressure and everything, so that you can push back up. So it is a specific technique. I'm not going to specifically talk into that. But when, again, balance. So if you're always only doing that, and then you're never going to the opposite, where's the balance within your body? Your brain doesn't know. So then it's always pushing out, and that's where you can get the tearing, and that's where you can get the incontinence and the other things that are happening.
Right. And I've seen some women have, they've had to have surgery, because it's so separated that it's, and it's, some of them, like, it's painful for them.
Well, the thing is with diastasis recti is that, does it come all the way together? Not usually. No. You're going to have, it's because that fascia lining has been so stretched. So fascia isn't a muscle. It isn't a muscle that gets, pulled tight back together. So we do our best with proper strengthening, proper breathing, proper nutrition to get that back as much as you can.
As close as you can
as you can together. But it's not going to be, unless you have surgery, it's not going to be fully
like lined up. Like, you're gonna have like a little, you're gonna have this space.
Yes, you're going to. And the other thing is, it's like, the more research we do, there isn't necessarily, like, we can't say across the board, you did sit up so you have diastasis recti, because there's probably other people who did core stuff and don't have it. So a lot of it does come back. Unfortunately, I hate to blame things on genetics, but a lot of times diastasis recti comes back to genetics. So did your mom have it? Did your grandma have it? I would look into those kinds of things and just start preparing yourself, start understanding knowledge, what exercises are good while you're pregnant, what should you be doing, and what do you do afterwards.
Right. No, definitely, that is a valid point too with genetics, because that's, sometimes if it's in your family, it's, chances are you're gonna run into that issue too.
Yeah. Someone asked if you should be doing Kegels when you're pregnant, and I would say you should never just do Kegels alone.
Right.
I mean, the pelvic floor works more powerfully when we use the core and the glutes.
Right, exactly. And it's normally when I'm having somebody go through a series of movements, it's like, okay, engage the pelvic floor, and then let's move.
Yes.
You know, so at that point,
so it works in conjunction. It's never just like, let's sit here and
expect
little movements to be
right.
Yeah, it doesn't work alone. You don't move. You don't walk with just one muscle. You don't do anything with just one muscle. So our body works in conjunction with everything.
Right. Exactly.
So that's how we want to be treating it. That's how we want to be addressing it, working it, strengthening it, all of that. So I would say if you're pregnant, a really good thing to do is hopping into a Pilates class that the instructor understands pelvic floor and pregnancy.
Yeah, that's an important point that you made. That they are familiar with it and they know.
There's specific certifications for Pilates instructors to have a better understanding of pregnancy.
Post and prenatal.
Yeah, and then if you're having pain, if you're having back pain, because it's very common, there's a lot of laxity within the area.
Right.
A really good person you can see is your woman's health therapist, because they are specifically trained in pelvic health, in what's going on, especially during pregnancy and after pregnancy. A lot of people don't know that there's PTs that are specific in these areas, and I'm telling you, they're everywhere. So women's health therapy and Pilates instructors that are trained in pelvic health and in postpartum, pre and postpartum is everything.
Yeah, it's true. I mean, and again, it's like you want to make sure that you are, getting that help and those, going to those resources, because it's going to make a huge difference.
Yeah.
Definitely. Someone
asked, does strengthening the pelvic floor help with back pain?
Oh God, yes.
It does, but then it also goes back to why is your back pain? Where is that coming from? So can I say a solid yes, strengthening your pelvic floor is going to help with back pain? It probably can, but that might not be your true cause. So it depends. It depends. But it definitely can. I don't think it would hurt it.
Right. Exactly. Somebody else. I can't see.
Just joined. If I stand in front of it, I can read it a little bit better.
I know. It's like, are you...
Oh, are you talking about abdominal muscle separation? Yes, we were talking about that. Ton of holding and spot. Sorry, we're trying to read a comment.
I had a huge separation with 3 babies. I did a ton of holding that
spot with my hands, visualizing the weaving. Oh yeah, visualization is super powerful. So your mind is everything.
And that's the main, that's one of the cues I use when I teach.
Yeah.
It's all about visualizing.
Visualization
that's huge.
So that's really good. Someone said that they were visualizing when they had the separation of their abdominals after they had babies, is visualizing that weaving together of that fascial tissue and of kind of pulling it together when you're going through exercises. Powerful.
Yeah.
Powerful. Even if you're just breathing and thinking of that. Powerful.
Definitely. Let's see. How to
minimize ACL pain. We're not getting on that right now. Go see your therapist. The ACL is really specific. All right, guys, we're gonna hop off. But if you want more information about, especially, she makes the program so easy. It's body weight Pilates, and it includes everything that we were talking about. It's really probably a majority of your people are female.
Majority, yes. Definitely.
Unfortunately,
for men, it's more of a different type of program, but the main program is specifically for women.
Yeah. But men, Pilates is great.
Yes.
We both taught to huge CrossFitters, and they're some of our favorite clients. So it's needed, it's necessary for everyone to kind of understand, to get just a deeper appreciation of these small muscles that we're not even aware of. And the fact that you can do it anywhere, you don't need the fancy equipment, is really, it's really powerful. So screenshot this so you can see what her handle is, so that you can go follow her and then check out her program. Is it linked up in your bio?
Yes. It's at Bodyweight Pilates.
Bodyweight.
Simple enough.
Bodyweight Pilates. That's super simple.
Yeah. Very, very
your own
simple.
body weight, just doing Pilates. You don't need any fancy equipment again. It's really She taught me a lot of what I know. She got me into this movement world, into this fitness world. So if you want to know what I know, you should probably check her out. This is what I'm saying.
This is good stuff. Okay, please, Pilates was created. Yes, it was.
Pilates was created by a man. Yes. So true.
It's so
Thank
true.
you for the reminder.
Yes, it was.
I was working with a guy who was learning. Pilates was supplemental to him learning handstand push-ups. So just saying. It's pretty awesome.
It's pretty awesome.
Okay.
Yeah. Just
love you guys.
Just Pilates. Bye, guys.
Oops. Maybe.